Good day, I'm Andrea Chizom and this is your JIS News for Wednesday, May 6. The Health Ministry will be conducting a comprehensive audit of the island's major hospitals and health centers to determine the availability of supplies and other challenges. Minister Fenton Ferguson made the announcement on Tuesday during his sectoral presentation to Parliament.
The results will be addressed through the additional resources provided for pharmaceutical and sundries in this financial year's budget.
In the meantime, Dr. Ferguson said plans to implement a shift system in the public health sector were being suspended until a task force established to examine the delivery of medical care had completed its work. The minister also reaffirmed his commitment to work with all professional groups within the health sector.
And I will be meeting with the doctors and their professional groups, as well as other sectors, to ensure that any plan we develop will be done with the input of those working in the sector, as well as our international partners.
Meanwhile, 12 secondary healthcare facilities will be upgraded this fiscal year at a cost of $460 million.
Among these facilities, Mr. Speaker, will be the further expansion of the Linstead Hospital and the Princess Margaret Hospital accident and emergency area.
The health minister says several primary healthcare facilities will also receive attention.
This year we intend to undergo work. We plan to undergo work at Grangeville Health Center in Westmoreland, Comprehensive Health Center in St. Andrew, Maxfield Park Health Center, Christian Penn in St. Catherine, Runaway Bay in St. Anne will receive brand new clinics.
The Buff Bay Health Center in Portland and the Stony Hill Health Center in St. Andrew will also be upgraded. The design is also being completed for a new health center in Port Maria, and the ministry is reviewing funding options for a new health center in Old Harbor. And the health ministry has made a major move to improve cancer care and treatment in Jamaica. On Tuesday, the ministry signed a contract with the Varian Medical Systems to build 2 cancer treatment centers at the St. Joseph's Hospital in St. Andrew and the Cornwall Regional Hospital in St. James.
This project represents one of the biggest investments in equipment and service for Jamaica.
The project is being financed by the National Health Fund and the Culture, Health, Arts, Science and Education Chase Fund at a cost of $14.465 million. The first center will be ready within a year and the second in approximately 18 months. They will deliver state-of-the-art radiation equipment and treatment to Jamaicans suffering from the deadly disease.
That would move the cost significantly as it relates to the private sector down for the most vulnerable in our society to zero.
The Economic Program Oversight Committee, EPOC, is reporting that Jamaica should pass the 8th IMF test. EPOC's co-chairman Richard Baz made that assessment in a press briefing on Tuesday, even as he reported that the country missed the primary balance target for the January to March quarter of this year. The primary balance was $117.2 billion, 4.1 billion below target. Mr. Baz said the IMF team, which is currently assessing Jamaica's performance for the March quarter, would have to decide if the macroeconomic circumstances beyond the control of the authorities were sufficient to influence the missed target.
Secondly, and just as importantly, I think they have to evaluate whether the country and the government remains as committed to the program, and did they display the effort needed to achieve the target. I think that I can say unequivocally from EPOC's point of view that the IMF should give the country a waiver based on these 2 facts.
In the meantime, Mr. Baz said the fiscal balance at the end of the quarter showed a deficit of $7.8 billion, 3.6 billion below projections.
And what this means is that the government has to borrow less in order to meet all of its expenditures, including the payment of interest. And so that's good because it reduces the debt buildup.
A $624 million sewage conveyance system is being developed for the Caymanas Estate property in St. Catherine. The project is to facilitate further development of the area. The Urban Development Corporation recently signed a contract with YP Seaton and Associates to undertake the 8-month project. Work is to begin within 4 weeks.
This project will cover approximately 7.4 kilometers, and this will necessitate the construction of force mains and 2 lift pumps in order to move sewage from the estates to Soapberry.
And finally, Transport Works and Housing Minister Dr. Omar Davies says the Jamaica Emergency Employment Program JIP remains one of government's key vehicles for responding to unemployment and improving the country's physical infrastructure. Dr. Davies was speaking in Parliament recently, where he also welcomed the appointment of Carolyn Gardner as the new director of JIP. Mrs. Gardner, who started duties on April 16, worked previously as Chief Operations Officer of Health Oasis and Assistant Director of Communications and Marketing at Global Aid Network in the United States. She replaces Lucille Broadber, who headed JIP for 3 years.
Let me put on record appreciation for the work of Mrs. Lucille Broadber. But we have been able to replace her with someone of equal competence.
And that's it for JIS News today. I'm Andrea Chisholm. Thank you for watching.